three most common reasons for hip replacement would include osteoarthritis, hip dysplasia, or post-traumatic arthritis. Osteoarthritis is probably the most common, and that frequently affects patients age 60 and older. Hip dysplasia more often affects patients in their 50s or sometimes earlier. And then post-traumatic arthritis can be any time throughout your life. So when you get these conditions, frequently it causes thinning of the cartilage surface, and in some cases deformities of the femoral head, making the surface between the pelvis and the femur incongruent, causing severe pain. Patients will frequently perceive severe pain into their groin, but in some cases into their buttocks or into the side of their hip. There's multiple different approaches to hip replacement surgery. You can either access the hip through the side or through the front, and in most situations I prefer to access the hip through the front. It's called the direct anterior approach. I like this approach because it can help reduce the amount of time for recovery and help decrease the risk of dislocation. So for the surgery, you're lying flat on a table. The femoral head is removed from the top of the femur, and a stem is inserted into the center of the femur. A ball is then put on top of that stem. On the pelvis side, the acetabulum is reamed and a shell is put in place, sometimes held in with screws, and then a plastic liner is snapped into position. And then the two pieces are relocated together, making a new hip joint.